Can everybody see this?
Yes.
Thank you. So I want to thank Hazel because I agree with her comment. One fall can change a life. And that's really true, especially if people experience a traumatic brain injury when they fall. And in addition to being in the field, I have taken care of senior adults in my family and who have fallen. So I like listening to some of your prevention efforts. So I'm going to talk a little bit about what a TBI is, a little about epidemiology and injury mechanism, falls in older adults, falls in children, and the effects of TBI in these groups, because I think that really helps you understand why we need to prevent falls. So as you know, a traumatic brain injury, and this is all on our website, by the way, is an injury to the head that affects how the brain works. So there's several causes of it, but there's three main types: a mild TBI or concussion, which is considered a mild TBI, moderate and severe. And I think when seniors fall or children fall, they can experience a TBI in any of these areas. So I'm just going to point out that we do surveillance at CDC, and our most recent reports are published on our website. So I'll let you go to there to get the details more about what our current reports offer. But really, older adults and young children have the highest number of emergency department visits for TBI related to falls. These are the two groups that we're very concerned about. Older adults have been the primary group for many years of reporting about TBI. So you all are in the right area to work on this. I just want to mention about what we've learned from working with children. We did a study with Children's Hospital of Philadelphia because they have a big network that includes primary care, urgent care, EDs, hospital, specialty clinics. And what we learned from looking at that is that a lot of kids go to primary care when they have a concussion or mild TBI. And while we don't have data on that on seniors, this points out that we may be underestimating what we've learned from emergency department visits, because seniors may also go to their primary care when they experience a fall. So I'm going to talk a little bit about older adults. And Donna Walsman, my colleague, and I, and Lindsay Womack, wrote a little commentary. It was an invited viewpoint in JAMA Neurology, where we summarized our concerns and findings. We did that to start the conversation nationally that we really do need to work on preventing falls and TBI in older adults. So what happens after a fall-related TBI? Initial recovery, patients may experience a decline in neurologic function. Older adults are more likely to be hospitalized and die from a TBI. And a TBI also may be misdiagnosed or missed in older adults because it overlaps with other medical conditions that are common with older adults, such as dementia. And so the effects of it that we've seen, and this has been reported in the citation below, is older adults experience neurologic deterioration. They may have memory changes as a result of their traumatic brain injury, sleep changes, and lose independence. So because of this fall, they may not be able to go back to their homes living alone. And this has been talked about already, but fall risk factors that we need to think about in older adults, especially if they have chronic conditions, cardiovascular and pulmonary diseases. If they're on medications, side effects can cause dizziness. Older adults may also have vision impairments, cognitive impairments, gait and balance issues, and foot issues. And as I'll explain in children, older adults, head injuries in young children start before age 5. So people who are older may have a prior history of traumatic brain injury that's contributing to their fall risk, and also their living environments. There may be home hazards and dangers, broken or uneven steps, throw rugs, or clutter that can be tripped over. And I think several folks have talked about these, how to minimize some of these risks, which is great. So this is a link to what our falls prevention team is doing at CDC. They've developed a great prevention program called STEADY, and it suggests screening patients at risk for a fall when they're coming for well checkups, assess their risk factors, which healthcare providers and families can do, especially families if senior adults are living alone, and intervene with effective clinical and community strategies. And nicely, Kentucky is doing a lot about fall prevention. So that was discussed earlier. But these are all what's on the CDC website for older falls prevention. You're welcome to access this. Use it in your state programs because there's some great things here. So here's what they're suggesting on this website. The link is at the bottom. Really talk to your healthcare provider or your doctor to ask about fall risk and review medications to see if any might make you dizzy or sleepy. Have your eyes checked. And I'm in this senior group, so I've been advised by my doctor to keep checking my eyes to make sure that I can see and I don't have things that blur my vision, and update my eyeglasses. Another one, which Hazel talked about, several folks talked about, is do strength and balance exercises. Tai Chi is a good example of this kind of exercise, but this is also available not only on our website, but I think in the state of Kentucky, you have this kind of information available. And also making homes safer. So getting rid of things that could be tripped upon, grab bars inside tubs and showers, railings on the stairs, and plenty of lights in the home. And again, this is on our website and also on yours. So we really want to keep older adults happy and healthy by engaging in exercise, being out in the community, and that will prevent some falls in older adults. Now, I'm going to talk about, I'll finish my whole talk and then we can have discussions, but I want to talk about traumatic brain injury in children and talk about the public health burden. So we know children, actually senior adults have the highest rate, but children in this age group have the highest rate. And what's unique about TBI in children, it can affect child development, and effects may not be seen until children grow up or as they're proceeding through development. And this is a report to Congress we did on the management of traumatic brain injury in children. You can see it on our website. The link will be in the slides. This was released in 2018. And one of the things we did, we wanted to identify gaps in healthcare, school, and community services and highlight policy strategies to address short and long-term effects of TBI. And one of the things that we mention are these three words: recognize, monitor, and care. And I think that's true for older adults too, that we need to recognize that they fell and had a TBI, monitor them over time to watch for symptoms, and take care of them when they need extra help. So we wanted to mention, here's a few recommendations that I'll summarize from this report. Ensure all children who return to school are monitored and have coordination of care across both medical and educational settings. We want to train educational professionals because that's where children are the majority of time at school. And children have transitions from elementary to middle school, from pediatric to adult health care, and much research is needed for longitudinal studies for this age group. So what contributes to fall risk in children or injury risk? Falls are really the leading cause, but as you know, thanks to the NFL and sports community, sports injuries have really brought traumatic brain injury and concussion to the forefront. And that's another contribution to risk: motor vehicle crashes and bicycling accidents. And we did this paper also with Children's Hospital of Philadelphia on mechanism of injury, because it does vary by age. So you see those younger age groups, it's primarily non-sports related like falls, but as children get older, particularly in high school, so that's more in that 13, 14 to 17 age range, they're more likely to have a TBI from a fall, from a sports related injury. And so I just want to mention a paper that we talked about that's been published about children in the 0 to 4 age group, because we really looked at narratives in NICE data to see what adult and child actions were actually contributing to their falls. So we know the falls are the leading cause of TBI in this age group, and this age group is very vulnerable to long-term effects. And there's limited literature, so we tried to provide a national expert that describes actions and products. So you see NICE data has narratives it's on the left-hand side of my screen that we can show you what we looked at. And so we looked at all these narratives, and I had wonderful interns who coded close to 39,000 narratives. So we thank them for that. But what we learned from this, not only about actions, but products, because we had product codes in here as well. And what we learned is a large number of children visited the ED annually for falls, and it significantly increased between 2001 and 2013 when we were looking at this data. 93% were treated and released to home. Child actions mostly occurred as children were between the ages of, say, 3 and 4, 3 and 5, because that's when they're running and jumping and playing. But actions by others were the highest for children younger than 1 year, which is not surprising because they're not always real mobile yet, and adult actions are more related to those falls. And as we know, I think this is true for seniors too. The majority of the falls are in the home and involve surfaces, fixtures, and furniture, and for kids, baby products like cribs. So we looked at these coded, 87% were coded as internal injury to the head, 96 were coded as concussions, and a small amount were coded as fractured skulls. Most of the falls were male children. And if we look at ages, the majority of the falls were less than 1 year, which means a lot related to adult actions. And here's some child actions: rolling and climbing. Under a year, as we would anticipate, 3 to 4 years, jump, trip, and run. Actions by others were highest in children younger than 1 year, like dropping. And as they got older, carrying, pushing, and pulling. Here's some products that we learned about. And as you can see, younger than 1 year, it surfaces for everybody, but it's really not till 3 and 4 years when we start to see sports and rec related injuries, when children, even preschoolers, start in preschool sports. So we really wanted to work on what can we do to prevent falls in this age group. Environmental modifications, some of these are the same for teenagers or for senior adults. Environmental modifications, removing hazards. In kids, we say improve parental supervisions, but I think in older adults, we need to make sure they're monitored and that they're living in safe environments for sure. So I want to mention with kids, it presents a significant public health burden. The majority of injuries occur in the home, like seniors. And fall-related TBI in this age group, young age group, coincides with reaching developmental stages such as independent mobility, exploratory behavior, at a time when children may have not developed awareness and avoidance of hazards. So why are we concerned about children? Well, we're concerned about older adults too, but children are at risk for the long-term effects of a TBI, and there's very limited longitudinal studies. Children are seen in two models of care, healthcare and schools. And that's very important to understand. We need to do things in both models of care because how they're identified is very different. In healthcare settings, the providers make a diagnosis many times or an athletic trainer, but in schools, they rely on parent-student report or observation of an injury. But you see at the bottom, the event occurred but did not seek medical care. We see that as an issue particularly with mild traumatic brain injury or concussion. I think that's also true for seniors. A few bits about what we know about TBI across the pediatric lifespan. Age of time at injury means something because younger children are more at risk for long-term effects. Past and current health history means something. So this is a paper where we looked at the National Survey of Children's Health, and we learned children whose parents said, yes, they have a lifetime history of TBI, they're more likely to have some co-occurring health conditions such as learning disorders, behavioral problems. You'll see them listed here. We also know, and I think this is somewhat true with senior adults, injuries are individualized, really. The effects and outcomes relate to injury characteristics, what happened, individual child characteristics, and the child's environment where they're living. We also know that outcomes in all these areas are important. So medical and health, cognitive, educational, behavioral, and emotional, all important to better understand outcomes. And even though what we want for kids is we want them to graduate, go to school, get a job, but what we've heard most about is that there's a very high report of a childhood brain injury in the justice system. This literature has informed us that we need to look at preventing and taking care of kids with TBI. What's different about kids than older adults is they go through all these transitions during childhood, but then the transition to adulthood. And I have Wile E. Coyote there because in essence, they kind of jump off a cliff because we don't know what happens when children transition to adulthood who've experienced a TBI. There's very limited research out there. So particularly, we want to recognize, monitor, and care for children who've experienced a TBI. And I also want to mention some research that's coming out, it's in progress, on traumatic brain injury as a chronic health condition. Currently, it's not described as that. And here's some criteria from the World Health Organization that talks about what is a chronic health condition. And I would say John Corrigan and Flora Hammond have done some research on this area, and they currently have a grant from ACL to look at a chronic health model. How do we develop that? And although most of the reports on moderate to severe most of the reports on chronic health conditions are on individuals who's experienced moderate to severe brain injury, more and more research is coming out about concussion and mild TBI, about people experiencing long-term effects over a year or more. So that we're looking to update on what really is a chronic condition for TBI. And this is a paper recently about that we talked about, when does TBI become a chronic health condition in children? We hope to get the conversation started. But really, adults who report a childhood injury report post-TBI and behavioral changes that result in financial and emotional changes over the years. So we really want to be careful about making sure people are monitored. This describes all the work that we've done in our HeadUp program, which is primarily for children over the last 20 years, but currently we have more information reported on mild TBI in adults. There's been a recent guideline release, and we have information on our website about traumatic brain injury in adults. And I want to end this conversation by saying, no matter what age a TBI is experienced, it's not just an event that you hit your head and you get it, you go to the ED and it's taken care of. People can have very long-term effects that totally impact their lifestyle. So we need to make sure that they receive care for their TBI and that they're followed and monitored. And this is my contact information. Please contact me if you have any questions. And I'm going to stop sharing and allow time for discussion and questions in the chat. And I know I'm a little bit early. I think everybody's early today, right? But thank you for inviting me to come.
Thank you. Any questions or discussion? Okay.
Hi there, can you hear me? Oh,
Hi, Carrie. Yes.
oh, sorry, there was a bit of a delay. Thank you. Thank you for your presentation. And I was just wondering, are there any studies on your radar, either past or upcoming, that explore the role of osteopathy, the osteopathic manipulative treatments in helping to mitigate some of the issues with TBI?
That's a great question. I've seen a few studies like that in the literature, but I can't recall any off the top of my head, but I think that has been mentioned. And that means taking care of seniors who have need a knee replacement or have orthopedic issues, right?
Actually, and let's be a little closer to the microphone. I was specifically wondering, and my mother, who's here with me and listening as a senior, has had many years of osteopathic manipulative treatments, which are osteopathic physicians who work with the cranial field. So like when she's fallen and hit her head, throughout her life, she's often been able to go to an osteopath and receive like a cranial, a non-invasive, very subtly based adjustments. But she would report that the difference in how she feels and her ability to sort of recover when many her age have not, she would attribute to the osteopathic treatments. So I was just curious if that had been on your radar. I'd be happy to email you, but the presentation was very helpful. So thank you.
Thank you. And that's great that she had an intervention that's helping. That's really nice to hear.
Yes. And she would say she's known many doctors who've done the same type of work for children, or for all ages, but to the ability to help kind of address the physical change that would happen from the head being hit and the suture, the shifts that are occurring from the impact, getting those things kind of eased.
Yes.
Okay.
Thank you. Thanks for mentioning that. Best wishes to you and your mom.
Thank you.
Juliet, because we started early, Dana was wondering, missed the first few minutes of the presentation. Will the slides be made available? And if so, when? And my other question would be, this is being recorded, is it all right to share the recording?
Once the slides are cleared, you can share the recording and I'll send a PDF of them. But for now, I just use them to guide my talk.
Is there any time frame for
It should be
release?
done in a few weeks. It should be done. I was online talking with Amanda, and hopefully by the time she gets all the links ready, it'll be ready.
Okay.
But thank you. I appreciate that question.
Any other questions? Okay. Will there be any resources from CDC for Fall Prevention Awareness Week that's coming up?
Yes, you can go to www.cdc.gov and type in fall prevention for older adults. And they do have on our website currently information on STEADY and all the activities related to that. So there is some more information. Please view our website.
Okay. Just to let you know, I know they have been working also on a governor's proclamation. I think the governor will issue a proclamation for Fall Prevention Awareness Week in Kentucky.
Awesome.
So, and that'll be shared with the members of the Kentucky Safe Aging Coalition. I know I mentioned our website on K-SPAN. You can join K-SPAN.
Mhm.
And also we send out newsletters, and along with that will be like the proclamation and any other information about meetings. So it's free to join. So we invite people to join. I had the address in our chat box. It's safekentucky.org.
Okay. Yeah. Well, the work you're doing in Kentucky is very impressive. So I hope that you'll reduce the numbers, and it's just great work. Thank you.